Daily infections have almost halved in a week to the lowest levels since September, today's figures show, as Britain's COVID outbreak continues to shrink rapidly.
Deaths have also plunged by 42% according to the government's own data. That will pile more pressure on Boris Johnson to consider easing draconian lockdown restrictions sooner. Department of Health bosses today posted 5,455 more infections and 104 fatalities. It is the lowest daily case toll since September 28, and the fewest victims since October 26. For comparison, 10,641 coronavirus cases and 178 deaths were announced last Monday. With a catalogue of statistics showing the second wave is firmly in retreat, anti-lockdown Tory MPs are demanding restrictions must be lifted sooner. No 10 has promised all curbs will go by June 21 at the earliest, so long as the vaccine drive is successful and continues rolling out hundreds of thousands of doses a day.
Britain's vaccine minister Nadhim Zahawi claimed today the COVID inoculation rollout could go at twice its current speed over the next 3 months. He promised March would be a very big month for the program. Another 185,000 first doses were dished out yesterday, up by almost a third week on week.
It comes after the Prime Minister insisted the Brazil coronavirus variant will not derail his lockdown roadmap as he vowed a massive effort to stop it spreading further. He played down the dangers amid a huge hunt after health officials admitted they do not know the identity of one of the people infected with the worrying strain. 6 cases of the P.1 variant first detected in the Amazonian city of Manaus have been confirmed in Britain, 3 in England and 3 in Scotland.
2 were tracked to South Gloucestershire, but the third English case has not been located and may be anywhere in the nation because they failed to fill in personal details when they were tested for COVID. Public Health England has said it is working with the Postal Service to try and track where the kid had been sent.
In other coronavirus developments today.
Name, B.1.1.248 or P.1.
Date, discovered in Tokyo, Japan in 4 travelers arriving from Manaus, Brazil on January 2.
Why should we care? The variant has the same spike protein mutation as the highly transmissible versions found in Kent in South Africa, named N501Y, which makes the spike better able to bind to receptors inside the body.
It has a third, less well-studied mutation called K417T, and the ramifications of this are still being researched.
What do the mutations do?
The N501Y mutation makes the spike protein better at binding to receptors in people's bodies and therefore makes the virus more infectious. Exactly how much more infectious it is remains to be seen, but scientists estimate the similar-looking variant in the UK is around 56% more transmissible than its predecessor.
Even if the virus doesn't appear to be more dangerous, its ability to spread faster and cause more infections will inevitably lead to a higher death rate.
Another key mutation in the variant, named E484K, is also on the spike protein and is present in the South African variant. E484K may be associated with an ability to evade parts of the immune system called antibodies, researchers from the Federal University of Rio de Janeiro said in a scientific paper published online.